PSVT. This is paroxysmal supraventricular tachycardia, in which paroxysmal means the onset is sudden as well as the offset. So it goes abruptly from 60 beats per minute to 100 beats per minute, and this causes the symptomatic palpitations. Supraventricular is because the electrical activity occurs above the ventricles, in contrast to the ventricular tachycardia, where the origin is in the ventricular myocytes, and this produces a narrow QRS complex. AVNRT is the atrioventricular nodal reentrant tachycardia. This is the most common cause of PSVT and is more common in young women. This requires a dual AV nodal pathway for it to occur. See, normally in the AV node, the conducted electrical impulses are usually at the same speed. However, in AVNRT, there is a dual pathway in which some cells conduct slowly and some conduct them fast. Slow conductions have a short refractory period, while the fast ones have a long refractory period. So the problem occurs when the fast cells are in their longer refractory period and the slow pathway depolarizes the His bundle, and then the fast pathway is then generated and conducts the electrical wave. So what we see on an ECG is retrograde P waves that occur after the QRS complex and are seen on every beat. Now, WPW, or Wolff-Parkinson-White syndrome, is a cardiac electrical disorder. The cause is the accessory atrioventricular pathway. This pathway conducts impulses from the atria to ventricles bypassing the AV node. This is sometimes referred to as the bundle of Kent. These cause a pre-excitation where the ventricles depolarize before the AV nodal impulse. This may lead to arrhythmias, and the classic finding on the ECG is a delta wave and a short PR interval. This occurs before the QRS complex caused by an accessory pathway. Due to the delta wave, the PR interval is short, so these together are the classic findings of WPW. Atrial fibrillation in someone with WPW can be life-threatening because this causes a wide, complex, irregular tachycardia. In these incidences, slowing the AV node conduction can be dangerous because this allows more impulses over the bypass tract. Therefore, the usual atrial fibrillation therapies are contraindicated. So there we have it. We have just covered the common ECG abnormalities and their characteristics. For more videos like these, keep watching sqadia.com.